Good afternoon, and thanks for joining us for this coronavirus HQ update. I'm Isabella HULSIZER. 2 people at the White House have now tested positive for the coronavirus, prompting some of the health experts on the coronavirus task force to go into self-quarantine. But not everyone who has come into contact with the individuals is staying out of the office. Natalie Brand has more details from the White House.
Vice President Mike Pence is back at the White House working this morning despite his press secretary Katie Miller testing positive for COVID-19 late last week.
It is scary to go to work. You know, I was not part of the White House in March. I think that I'd be a lot safer if I was sitting at home than I would be going to the West Wing. But, you know, it's a time when people have to step up and serve their country.
Dr. Anthony Fauci, CDC Director Dr. Robert Redfield, and FDA Commissioner Dr. Stephen Hahn are in some form of self-quarantine and will testify remotely before a Senate committee tomorrow. White House officials say the new cases do not step on the president's push for states to reopen.
I don't think it changes the push to go back to work in any way. I think we've been very consistent. The president's been very consistent. We want to open the economy in a clear and careful way, balancing the medical issues with the economic issues.
Vice President Pence held a conference call with governors this morning as more states move to loosen restrictions. Some state leaders say they still need more testing before fully opening back up. President Trump has a news conference this afternoon expected to address the issue. The FDA has issued emergency use authorization for a new antigen test. It looks for fragments of virus proteins and samples collected from the nasal cavity and provides results in just minutes. But the FDA warns it has a higher chance of false negatives.
True, there's a slightly higher false negative rate. It's not dramatically higher, it's slightly higher. But the trade-off is you could do lots of these inexpensively.
California-based Quidel is the only company authorized to produce the antigen test at this time, but the FDA says it expects more to follow. Natalie Brand, CBS News, the White House.
The FDA also issued an emergency use authorization for Abbott Laboratories today to begin an antibody blood test. The fate of Governor Evers' safer-at-home order still hinges on a ruling from the Wisconsin Supreme Court. It's been 7 days since justices heard oral arguments. The court must decide whether the DHS secretary-designee had the authority to extend the order to May 26th. The court, which has a 5-2 conservative majority, is usually predictable, but waiting nearly a week or longer is not. According to some political experts, the delay could mean we're going to see an unpredictable ruling.
We have to interpret this as being meaningful, as being unpredictable, because it's the opposite of what they did when they told the governor he could not cancel the election.
To uphold the safer-at-home order, 2 conservative justices would need to side with the 2 liberals. More than 10,000 people in Wisconsin have tested positive for COVID-19. 400 people have died. More than 5,000 people have recovered. In Monroe County has 1 new case and Jackson County has 2 new cases. LaCrosse and Crawford counties both have 1 new recovery. Right now, LaCrosse County is not meeting the state's testing goal. The health department is discussing the possibility of sending an application to the National Guard for another testing site in the county. Health Director Jen Rumbalski says they want to take advantage of any help they can get.
Our residents deserve us bringing in a resource, if there is one available, to increase testing so that we have a better understanding of what's happening in our communities.
According to the county's data, the current average of daily tests in the most recent 2-week period is at 63 tests per day. The county's goal is 247 tests per day. In Minnesota, there are now nearly 11,800 infections and 591 people have died. More than 7,500 people in the state have recovered. In Alameda County, there are 112 cases and a little more than 12,000 people in the state have tested positive. 265 people have died. There are more than 5,200 recoveries. Winona Health is now offering antibody testing, which indicates if you have been exposed to COVID-19. Anyone can receive the test. Just stop by urgent care and let the staff know that you would like to be tested. The test involves a blood sample and is billed to your insurance. You cannot take the test more than once within a 14-day period. For more information, call urgent care at 507-474-7830. The Gunderson Health System is now offering limited in-person care. This is for low-risk, high-priority patients. Gunderson says do not let concerns of COVID-19 prevent you from getting the test you need, especially urgent care or emergency care. But be aware that you still need to wear a face mask and follow social distancing guidelines when visiting. You can find these guidelines at gundersonhealth.org/COVID-19. Thank you for joining us for our coronavirus update. We hope you can join us again tonight at 5, 6, and 10.